Imagine losing your vision forever, never being able to see your loved ones, the sky, or even your own reflection. Now, imagine doctors using a tooth to restore sight. Sounds impossible, right? But this revolutionary procedure is changing lives. Stay with us as we uncover this mind-blowing technique and how it could change lives. Welcome to Levitas. What is the cornea? The cornea is the transparent, dome-shaped outer layer of the eye. It acts like a protective shield, allowing light to enter and focus properly on the retina. A healthy cornea is crystal clear, but when damaged, it can become cloudy, scarred, or irregularly shaped, leading to vision loss. Corneal blindness occurs when the cornea becomes so damaged that it no longer transmits light correctly. Unlike other forms of blindness, corneal blindness doesn't affect the optic nerve or brain. It's purely a structural issue with the eye's outermost layer. This means, in some cases, vision can be restored if the cornea is replaced or repaired. People with corneal blindness may experience blurry vision, glare sensitivity, eye pain, and, in severe cases, complete loss of sight. While traditional corneal transplants can help, they're not always successful. That's where the tooth and eye surgery comes in, offering hope to those who thought they'd never see again. What are the causes of corneal blindness? Corneal blindness is one of the leading causes of vision impairment worldwide, affecting millions of people. The most common causes include infections. Severe eye infections, like bacterial keratitis and herpes simplex virus, can cause irreversible scarring. Trauma, like chemical burns, accidents, or injuries can permanently damage the cornea. Genetic disorders, with conditions like keratoconus cause the cornea to thin and bulge, distorting vision. Nutritional deficiencies, including severe vitamin A deficiency, can lead to corneal ulceration and blindness. Autoimmune diseases, with conditions like Stevens-Johnson syndrome or ocular cicatricial pemphigoid, can cause corneal destruction. Globally, corneal disease is responsible for over 12 million cases of blindness. While corneal transplants help some, many patients experience rejection or don't qualify due to severe damage. This is where osteo-odontokeratoprosthesis, known as OOKP, or also as tooth and eye surgery, offers an incredible alternative, using a patient's own tooth to restore sight when other options fail. Now, let's dive into this groundbreaking surgical procedure. How does it work, and why is it changing lives? What is tooth and eye surgery? The tooth and eye surgery, or osteo-odontokeratoprosthesis, is a radical procedure designed to restore vision in patients with severe corneal blindness. Instead of using a donor cornea, this surgery uses a patient's own tooth to create a new optical pathway for light to enter the eye. Here's how it works. A small tooth, which is usually a canine, is extracted from the patient's mouth. This tooth is reshaped and modified to hold an artificial optical lens in its center, and this tooth lens structure is then implanted inside the eye, acting as a new cornea. But why use a tooth? Because it's a living structure, the body doesn't reject it like a foreign implant. The tooth's root helps anchor the prosthetic lens, providing long-term stability. Patients who have undergone tooth and eye surgery often describe it as a miracle, regaining functional vision after years of complete blindness. But what is the timing of this extreme surgery? Let's find out. When and why is this surgery done? Tooth and eye surgery is only performed in severe cases where traditional treatments have failed. Doctors consider it a last resort for patients who suffer from end-stage corneal blindness due to chemical burns that destroy the eye's surface, severe corneal scarring from infections or trauma, autoimmune disorders that prevent normal corneal transplants, or multiple failed corneal transplants due to rejection. This surgery is not suitable for people with optic nerve damage or total retinal blindness, as the procedure only restores the eye's ability to receive light. It doesn't fix deeper neurological vision loss. Because of the complexity of the procedure, it's only performed in specialized centers, and patients must have a healthy tooth to use for the transplant. Though rare, this surgery has given hundreds of patients worldwide the ability to see again when all other options had failed. Now, let's break down the step-by-step process of this life-changing surgery. How is this procedure done? The tooth and eye surgery is done in multiple stages over several months, ensuring the body can adapt to the implant. Here's how it's performed. First, tooth extraction and preparation. A tooth, usually a canine, is removed. A hole is drilled into it, and an optical lens is placed inside. Next, implanting the tooth in the cheek. The modified tooth lens structure is temporarily placed under the cheek skin for a few months, allowing blood vessels to grow into it. Then comes corneal preparation, where the damaged cornea is surgically removed, and a new opening is made in the eye. Ultimately comes the final implantation, where the tooth lens structure is carefully removed from the cheek and implanted into the eye, allowing light to pass through and restore vision. This multi-stage process ensures that the body accepts the implant, significantly increasing the chances of success. But like any major surgery, there are risks. What are the complications of this surgery? While tooth and eye surgery can restore sight, it comes with serious risks. These include infection, since it involves the mouth and eye. Bacterial infections can occur. There is also tooth resorption, where the implanted tooth may degrade over time, requiring replacement. Lens displacement, which involves the chance of the optical lens shift, causing blurry vision. Inflammation, since the body may develop chronic inflammation, leading to discomfort. Cheek scarring, because the procedure leaves visible scars where the tooth was temporarily implanted. But despite these risks, success rates exceed 70 to 80%. And most patients regain functional vision. What to expect from this surgery? Patients undergoing tooth and eye surgery should expect a long recovery period. Vision restoration isn't instant, it takes months for the eye and brain to adapt. The best candidates are those with end-stage corneal blindness, healthy teeth, and intact retinal function. Post-surgery, most patients can recognize shapes, faces, and objects, though vision may not be crystal clear. Regular follow-ups are essential to monitor for complications, and some patients may need additional procedures over time. But for those who had no hope of seeing again, this surgery offers a second chance at life, a chance to read, walk unaided, and regain independence. This groundbreaking technique proves that medicine and innovation can defy expectations, transforming blindness into sight in the most unexpected way. In conclusion, the tooth and eye surgery is one of the most extraordinary medical breakthroughs, offering a solution for patients suffering from severe corneal blindness. Unlike traditional corneal transplants, this technique bypasses issues of rejection by using the patient's own tooth, which naturally integrates with the body. Corneal blindness is a leading cause of vision loss worldwide, often resulting from infections, trauma, genetic disorders, autoimmune diseases, and nutritional deficiencies. Many patients are ineligible for standard treatments, leaving them with no viable options until now. The tooth and eye surgery procedure provides an alternative for those whose vision loss was once considered irreversible. This multi-stage surgery involves extracting a tooth, embedding an optical lens, and gradually implanting it into the eye. The process is complex and lengthy, but it offers life-changing results. Patients who undergo this surgery can regain functional vision, allowing them to see shapes, faces, and objects again. However, this procedure carries risks, including infection, inflammation, tooth resorption, and scarring. Despite these challenges, success rates exceed 70 to 80%, making it one of the most effective options for patients with end-stage corneal blindness. While not suitable for everyone, this surgery represents a remarkable fusion of dentistry, ophthalmology, and surgical innovation. It serves as a testament to human ingenuity, proving that, even in the most unexpected ways, modern medicine continues to restore sight and transform lives. Thank you for tuning in to Levitas. Please share today's video with friends and family, comment, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated, it helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So, stay healthy, stay happy, and keep going.